Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, the last type of lens-induced glaucoma is lens particle glaucoma, or we can also call it as phacotoxic glaucoma. In lens particle or phacotoxic glaucoma, here this is the cornea, this is the iris, this is the pars plicata and pars plana, and these are the ciliaries on which this is the lens. Okay, here there is a rupture of the capsule will occur. Because of the rupture of the capsule, again the lens proteins will reach the aqueous humor and they cause the obstruction of the trabecular meshwork. So this is a type of angle closure glaucoma because it is actually causing the this is a type of open angle glaucoma because it is not closing the angle is normal, but the trabecular meshwork is clogged by the lens proteins. So because of the lens rupture of the lens capsule, there is lens particles present in the aqueous humor, resulting in clogging of the trabecular meshwork. So this is lens particle glaucoma or phacotoxic glaucoma.
thank you and thank you for watching.